by 472 since I last reported on January the 12th. I would like to note that we have had a very tragic large number of deaths occur over the past week. We've had a total of 16 deaths. 13 of those deaths are from long-term care facility or institutional outbreaks. But I would like to express my condolences to the family members of those people who have passed. So they consist of the following individuals: a woman between the ages of 65 and 79 in Simcoe County, a woman between the ages of 65 and 79 from Simcoe County, a woman in her 80s from Simcoe County, a woman above 80 from Simcoe County, another woman above 80 from Simcoe County, a woman between the ages of 65 and 79 from Simcoe County, a woman above 80 from Simcoe County, a woman above 80 from Simcoe County, a man between the ages of 65 and 79 from Simcoe County, a man more than 80 years of age from Simcoe County, a man more than 80 years of age from Simcoe County, a woman between the ages of 65 and 79 from Simcoe County, a man more than 80 years of age from Simcoe County, a man between the ages of 65 and 79 from Simcoe County, and a woman more than 80 years of age from Simcoe County. This is certainly the greatest number of people who have passed away in a week in our history in Simcoe, Muskoka from this pandemic. I do note that for the first time in 10 weeks, our case count has actually gone down a bit. So if we look at the week of January the 10th, forward to the 17th, we had 450 cases, which is down from the previous week, which was 495 cases. So this is the first time we've had some reduction. I always express caution about optimism. It's certainly a good thing that is down. I very much hope that that's the beginning of a trend, but at this point it's a little too soon to say. Certainly it's a better thing than if it were going up. I would like to reflect a bit about the people who've passed, the deaths that we've seen over the course of our pandemic. And if we look at different time intervals, I think it's really important to note that we've had many more deaths now in the second wave than we had in the first wave. So if we look at the number of people who passed away from the beginning in March until September the 28th, we had 39 deaths. And since that time, we've had 52 deaths. So in every way, I would say that the second wave has been more severe, and including with regards to death, more severe than the first wave. When I look at the age range for these, in the first wave we saw an age range between people in their 50s and people in their 90s as those who passed away. In the second wave, the range has been between a person in their 30s and people in their 90s. We've noted that in both waves, the great majority of people were 80 or above. So in the first wave, 59% of people were 80 or above. And in the second wave, between September the 29th and November the 7th, it was 82%. From November 8th onward, it was 51%. So we're seeing some younger individuals among the more recent people who have passed away since November the 8th. The great majority of people who have passed away throughout the pandemic have been in Simcoe County as opposed to the District of Muskoka. The District of Muskoka has seen a total of 3 deaths throughout the entire pandemic. The great majority of deaths have occurred in institutional outbreaks. So in the first wave, up till the end of September the 28th, 67% of the deaths took place in institutional outbreaks. From September the 29th to November the 7th, it was 91%. And from November 8th onward, it was 61% of deaths taking place in institutional outbreaks. We've also had more institutional outbreaks in the second wave than in the first wave. Depending on the timing and when you consider waves ending, but if we considered the first wave over on September the 28th, then we had a total of 26 institutional outbreaks, and in the second wave, we've had a total of 35 institutional outbreaks. So far this week, we've had 126 cases from the weekend through to now, and in the past day, we've had 75 cases. 44 of them were sporadic, 28 were from institutional outbreaks, and 3 community settings. 29 of them were males, and 46 of them females. Their ages were ranging from less than 10 to in their 90s. All of them live in Simcoe County. 14% were community acquired, meaning that we don't actually know how they acquired their transmission. 15% were from close contact with other individuals. 28 of the cases, sorry, I'm going to repeat myself actually. 15 of the cases were close contacts with other known cases. 28 cases were from institutional outbreaks, and 3 from community setting outbreaks, and 15 under investigation. 51 of these cases are self-isolating at home, and 24 are isolating in their facility where they live. At this point in time, we have 1,348 active cases. In January, we've had a higher incidence of cases among females than males. A total of 264 cases per 100,000 population, compared with males of 230 per 100,000 population. This may be reflective of the institutional outbreaks that we've had in long-term care facilities, where there's a larger population of females than males, and also healthcare workers have a higher number of females than males. We have 37 cases in hospital, up from 33. They range in age from their 30s to their 90s. All are from Simcoe County, and 4 are in the intensive care unit. Currently, we have 20 outbreaks, down from 22 a week ago, 7 in long-term care facilities, 3 in retirement homes, 2 in hospitals. I'm just going to stop a moment. I did hear some background noise. If people could check and make sure that you're muted, that would be great. Thank you. I'll start over. So 7 in long-term care facilities, 3 in retirement homes, 2 in hospitals, 3 in congregate settings, 4 in workplaces, 1 in a community setting, none in educational settings at this time. So in terms of our institutional outbreaks, which would be hospitals, long-term care facilities, retirement homes, we have 12 institutional outbreaks, up from 11 a week ago. 3 are new, 1 at the Waterford Retirement Residence in Barrie, 1 at Bradford Valley in Bradford, and 1 at IOOF, long-term care facility in Barrie, and 2 declared over, Woods Park Care Center in Barrie and Simcoe Manor in Beaton. We have 3 outbreaks in congregate settings, down from 5, so 2 group homes in Simcoe County and 1 treatment facility in Muskoka. and we have 2 that are declared over since I last reported, a transitional facility in Muskoka and a shelter in Simcoe County. We have 4 workplaces in Outbreak, down from 5 a week ago, a new one at a warehouse in Simcoe County, and 2 that are declared over since I last reported, 1 financial service in Simcoe County and 1 business, a realty office in Simcoe County. We have 1 community setting with an outbreak, a service location, community service location in Simcoe County, and 1 that was declared over, a food and beverage establishment in Simcoe County. So the weekly incidence of cases has actually reduced compared to the previous week, in keeping with the reduction in the number of cases. So this is the first time that's happened in a long time, and that's a good thing, although I know with caution we need to wait and see if this becomes a trend that we would like to see. Specifically in Simcoe, Muskoka, we've had 75 cases per 100,000 population per week, which is 10% lower than the previous week. And the province's incidences also declined over that week compared to the previous week by 17%. The vast majority of our cases have been in southern Simcoe and in Barrie, so Barrie, Bradford, West Gwillimbury, New Tecumseh, Innisfil, and Wasaga Beach, although we do have significant number of cases throughout Simcoe, Muskoka. Bradford, West Gwillimbury has had the highest incidence of cases at 182 cases per 100,000 population, but this is down from what it was the week before at 228 cases per 100,000 population, and this is the 5th week in which they've been above 100 cases per 100,000 population. And they have the highest incidence in Simcoe, Muskoka. And the other municipality in Simcoe, Muskoka with a case rate above 100,000 is Barrie at 124 cases per 100,000 population. So we have good news with regards to immunization, and Simcoe Muskoka District Health Unit working very closely with RVH. Together we worked very hard. Some support from City of Barrie with regards to the location of our clinic on Sperling Drive, and from Simcoe Paramedic Services with regards to aftercare. We've received support from other agencies as well that I will speak to later in my report, but I definitely want to commend everybody involved. So we maintain a high rate of immunization to date, over 13,000 doses, so in total 13,317 doses were delivered as of yesterday. And in particular, over the past week, we immunized the residents of all of our long-term care facilities. That was finished on Saturday, and I'm very happy about that, very proud about that, because that provides these people with a strong degree of protection. It'll be stronger yet when we can get to them and give them their second dose, but even with a single dose, they get quite a bit of protection. And these are the most vulnerable people in all of Simcoe, Muskoka with regards to the risk of COVID-19, of becoming part of an outbreak and having a severe outcome, including death. So a total of 4,484 caregivers and staff in our long-term care facilities and retirement homes have received their first dose. And we've also had 538 of such individuals receiving 2 doses, their second dose, so fully immunized. And we have a total of 5,148 healthcare workers and in hospitals, as well as residents in those hospitals that are in chronic care units that have received their first dose. We've got nearly 90% or 2,845 residents in long-term care facilities that have received their first dose. And beginning this week, yesterday and today, we were vaccinating residents in long-term care facilities. Unfortunately, very unfortunately, we just had the breaking news that the supply of Pfizer vaccine is going to be severely diminished in the weeks to come, in the remainder of January and into February. And because of that, we need to take stock of exactly what our approach is going to be. We have numerous individuals, healthcare workers, and for that matter, residents in long-term care facilities and some in retirement homes, essential caregivers, and patients in the chronic care units within hospitals who received their first dose. We need to plan to be able to give them their second dose, and we certainly want to be able to continue providing protection, immunizing individuals, residents in the retirement homes that we've not managed to get to yet. And there are many others, of course, that we need to get to in the near future, including healthcare workers in the community and paramedic services personnel and others. Those are people whose roles, their exposure to COVID-19 make them a priority to receive vaccine. But at this point, we do not know, and we need to assess and look at what may be coming to determine when we can move and proceed with providing vaccine to those individuals. We have to take stock of the information we've just received and get more information about the details of what it means before we can decide what to do. So that is certainly bad news. I think we'll be fine in the long run when supply begins again, and we get on into the months to come, and supply is much more plentiful, and we can move on, provide immunization to those individuals, make sure we can provide a second dose to individuals, but also get ready to be able to expand immunization in the community at large, working with community partners, family physicians, pharmacies, and others. That will come. But at this point in time, we have this bad news about the immediate weeks ahead of us. With regards to our dashboard as a health unit, we remain in red status. This is a dashboard we've set for ourselves. It's not the province's framework that they had been following before they issued the shutdown and then the state of emergency and the stay-at-home order. So we continue with our framework, and we remain in red status. Certainly with regards to viral spread and containment, we still are in red status. Even though we've had some improvement now. With the laboratory testing, we are in yellow status. This is because of the test turnaround time still being more than a day, generally speaking, for us to get the test results. But we have had some improvement now with the test positivity rate. So test positivity rate is a combination of how much transmission is happening in the community and how much testing is happening. Are we doing enough testing? And so you want a very low test positivity number. Generally below 2% is desirable. Ours this week is 2.8%, which is down from 3.5% a week ago. So it's still relatively higher than we would like. It's certainly lower than the provincial rate overall, and it's come down a bit, which is a good thing. In terms of the health system capacity, we have categorized that as red, and the reason for that is we've noted an increase in occupancy in the intensive care units, and at this point in time, it's a 65.4% occupancy above the desired cutoff of 60%. We've also got acute care bed use in yellow status. So overall, the health system capacity is designated as red. Public health system capacity remains in red, and this is because we continue to be challenged in our ability to follow up with our cases and our contacts. We continue, for the most part, not being able to reach new cases within 1 day. So we're reaching within 1 day 76% compared with our goal of 90%. But this is actually an improvement, and it probably speaks to the fact that with a reduction in cases that have been happening over the last week, it's easier for us to get to the cases. In terms of our trajectory, as I've indicated, our incidence of cases per 100,000 population has come down, so 75.7 cases per 100,000 population per week, down from 83.3 per 100,000 population per week. The daily average growth rate is down to 1.4. It had been 1.8 a week ago. The reproductive number is 1.0, so anything above 1 means that there's growth. Anything below 1 means that there's shrinkage in the pandemic locally. And this is down from what it had been a week ago at 1.2. And our doubling time has increased, which is a good thing, that you want a very long doubling time, the time before you've doubled your number of cases. And so ours has increased to 49.5 days. And that's greater than it was a week ago. So on the whole, the week has been improving with regards to case count, certainly up though with regards to mortality, certainly up with regards to our active case count as well. If we look at our institutional outbreaks, and I've got these in order of the date in which they were declared. I know that there's a lot of interest, certainly, in Roberta Place, and I will be speaking to that, but I will work through these in the order in which we declared them. So, to begin with, Trillium Manor Long-Term Care Facility in Orillia, outbreak declared on December the 14th. The number of cases among staff is up to 24 from 19 a week ago. The number of cases among the residents is 10, up from 9 a week ago. We continue with our close monitoring, testing of that facility, and we were able to provide immunization for 93% of the residents last week, and 61% of the staff and essential caregivers have received immunization at that facility. So that should help as an additional control measure to help protect that facility, help to deal with the outbreak. Georgian Manor in Penitentiary, outbreak declared on December the 27th. They have 3 positive staff cases, which is unchanged from a week ago, and 3 resident cases, up from 2 a week ago. And we were able to provide immunization at that site as well to 93% of the residents last week, and to 44% of the staff and the essential caregivers. Lakeside Retirement Residence in Innisfil, outbreak declared on December the 26th, has 2 positive staff cases, which is unchanged from a week ago. And because that is a retirement home, we hope to get to it to provide immunization to the residents. Certainly that was our plan through this week and into next to get to the retirement homes, but at this point we have to take stock and see what we can do because of the slowdown in vaccine provision. Villa Retirement Lodge in Midland, outbreak declared on January the 2nd. They have 2 positive staff cases and 2 positive resident cases, both unchanged from a week ago. Immunization provided to staff and essential caregivers, and like I said, hoping to get to provide immunization at that site to the residents, but cannot guarantee it considering that we need to take stock of the vaccine provision. Grove Park Long-Term Care Facility in Barrie, outbreak declared on January the 4th. with 2 positive staph cases unchanged from a week ago. And last week we immunized 93% of the residents at that site, and 68% of the staff and essential caregivers have received their first dose of immunization. The Pines long-term care facility in Bracebridge, outbreak declared on January the 5th. 1 staph case unchanged from a week ago. And we immunized 95% of the residents and 75% of the staff and the essential caregivers. Roberta Place, long-term care facility in Barrie, and certainly this has been a severe outbreak and an intense amount of interest in this outbreak, what's happening with this outbreak, a lot of questions. I will get into a fair amount of detail about this a little bit later, but for now I'm just going to provide the basic stats. So that outbreak was declared on January the 8th, and to date we've got posted on their website from the facility, they're indicating that they have 92 positive resident cases and 57 positive staff member or team member cases, and they've also noted 12 residents who have passed, 10 of whom are a result of the virus. So we receive their information, we have to assess it for ourselves and enter that information. So we have the following information from our own data, noting that some of it we need to check before we enter the data, but according to our data, we're aware of 8 deaths, which is up from 1 a week ago when I last reported, and 65 residents who've had tests that have been confirmed to be positive, up from 40 when I reported a week ago. And I would also note that there was on-site testing yesterday at the facility with a team from Aurelio Soldiers Memorial Hospital using their rapid test that they have at their available at their assessment center at the hospital, which showed an additional 22 positive COVID cases. So 22 on top of the 65 that we know of. Those 22 would need to be laboratory confirmed by the province as well. We also note that 4 of their residents are admitted to RVH for care. And we also note that the number of positive staph cases, according to our data that we're aware of, is 56, up from 2 cases a week ago. So an enormous increase in the number of staff, enormous impact on the facility because of the number of staff that have been impacted. We note that the Red Cross there's been, as I said, a lot of response to this situation. So we've had the Red Cross do assessment for infection control and are preparing to bring in personnel. We've had RVH do that kind of assessment, assist with testing, use their infection control hub, and certainly we've had Simcoe County provide some expertise as well with regards to infection control, and we've had an offer of assistance with students, healthcare students from Georgian College, preparing to come online to provide assistance. And also we've had Simcoe Hospice Simcoe provide personnel as well in order to provide care for the residents. And also Simcoe County Paramedic Services assisting with immunization. On Saturday we were on site immunizing residents, essential caregivers, and staff. We certainly want to be at locations where there are outbreaks happening to be able to provide that additional form of protection with immunization. But we're not able to immunize those who are active cases, those that have symptoms, or those that have tested positive for COVID-19. because the vaccine wouldn't be able to help in that situation. So we immunized those that don't have symptoms, don't have positive tests. And so because of the size of this outbreak and the number of people impacted by this outbreak, we were limited in how much immunization we could provide to the residents. We were able to immunize 21 out of a total of 140 of their residents, so 15% of their residents were able to immunize. 46% of their staff and essential caregivers have also received immunization. I would like to also note the leadership being provided by Aurelia Soldiers Memorial Hospital, who've offered leadership support, and so that is also in place, and this really has been a coming together of the community, many community agencies to assist in this situation. I have issued an order to the facility for them to receive this support, including leadership from Aurelia Soldiers Memorial Hospital. This is really meant to just make it clear that this offer is to be accepted, to enable them to accept this support, and to do what we can to create an organized approach to providing support to this facility. There has been questions with regards to the strain of COVID-19 affecting this facility, and the question has been raised, is this in fact the much more contagious strain from Britain, or other strains that have been identified in the world that may be more contagious? And at this point, we don't know. We have submitted samples through the Public Health Laboratory System, Public Health Ontario's laboratory system, and it's actually being processed at the National Microbiology Laboratory. It is a process that takes some time, more than a week, so it will probably be another week, given that we initiated this midweek last week, and maybe another week before we get the result for that. It's a sophisticated test of genetic sequencing in order to determine whether or not this is a strain that is more contagious. So at this point, we don't know. Royal Victoria Hospital, Royal Victoria Regional Health Center continues an outbreak. They had an outbreak begin in their transitional care. I beg your pardon, they had an outbreak in their stroke unit, integrated stroke unit, beginning January the 9th, and now they've got an outbreak declared in their transitional care unit, declared on the 18th of January. They've had a total of 10 positive patient cases, up from 7 a week ago. They've had 3 deaths take place, and they've had 18 positive staff cases, up from 3 a week ago. Immunization's been provided to staff and essential caregivers, offered for them to receive that. And testing certainly continues to monitor for any potential further transmission, and otherwise control measures in place, assessment from an infection prevention and control having been done by the Simcoe Muskoka District Health Unit. Waypoint Center for Mental Health in Penitentiary, outbreak declared on January the 9th. They've had 2 positive staff cases and 2 positive resident or patient cases. So it's the same number of patients that are affected, but 1 additional staff compared with a week ago. And immunization has been provided to staff and essential caregivers at that facility, and otherwise close monitoring and repeat testing taking place. Waterford Retirement Residence in Barrie, outbreak declared January the 12th, with 1 positive staff case and staff and essential caregivers having been offered immunization. Bradford Valley Care Community in Bradford, West Gwillimbury, Ontario, outbreak declared on January the 14th, with 2 staff cases and 2 resident cases. 96% of the residents were immunized last week, so that should certainly help a great deal with regards to the provision of protection for the residents. IOOF, long-term care facility in Barrie, outbreak declared on January the 15th with 2 positive staff cases, and 90% of the residents received immunization in the last week. So once again, helping to create a much more protection for the residents. In terms of outbreaks in congregate settings, we have a group home in Simcoe County, outbreak declared on December the 20th, with 10 staff cases, up from 9 a week ago. 1 staff member is from a temporary agency who's a case, which is unchanged, and 5 resident cases, up from 3 a week ago. We have an outbreak at a group home in Simcoe County, declared on December the 26th, with 3 staff cases, which is unchanged from a week ago, and 2 resident cases, which is up from 1 a week ago, with ongoing testing and monitoring taking place. An outbreak at a community services location in Simcoe County on January the 15th, with 5 participants and 10 staff who are cases. In terms of workplaces, an emergency services location in Simcoe County, outbreak declared on January the 7th, with 9 staff cases, up from 8 a week ago, and otherwise negative testing for the others at the site. Food processing facility at Simcoe County declared on January the 11th, with a total of 13 staff, up from 7 a week ago. Swabbing having taken place at that facility. A retail location in Muskoka, outbreak declared on January the 11th, with 7 staff cases. I beg your pardon, 2 staff cases. And that facility, that establishment has been closed since December the 27th, with curbside pickup only. Transportation and warehouse location in Simcoe County, outbreak declared on January the 17th, with 11 staff cases, and a shutdown on January the 8th, with all employees being tested, and reopening on the 14th with limited staffing. So those are all of the outbreaks. I turn to my media notes. I've already touched on what's been happening with immunization to date, so certainly it's good news with regards to progress on immunization. And as I said, I really want to thank the many partners that have come together to achieve this. So we've had family physicians, primary care physicians, family health teams, community health center from across the region, including Waypoint and Couchiching, Ontario Health Team, County of Simcoe Paramedic Services, Muskoka Paramedic Services, Georgian nurse practitioner-led clinic, and other volunteers. So this is becoming very much a community effort to carry out this immunization. It certainly augments the capacity that we have as a health unit. And also we've had direct participation by RVH in immunization in some of these homes as well. So that too expands our capacity. And we're going to have to continue expanding our capacity, recruiting an ever larger circle of participating agencies as we go. So the slowdown in the vaccine supply is going to slow us for a time, but it won't certainly stop us, and we are going to ramp up and be well prepared for when we have more vaccine to come and to make use of all of that support and more. We have a new section on our website under Health Stats about immunization, and so you'll find the total number of immunizations provided. You'll find the proportion, the numbers that have received their first dose, their second dose. We've got a graph that shows its upward trajectory of cumulative number of doses that have been provided to date. We've got immunization by priority groups geographically. So right now, they're health care and healthcare provider and essential caregiver and resident categories for the receipt of immunization. And we've also broken it down between Simcoe versus Muskoka, just to keep an eye on geographic equity as we go forward. Certainly, we are looking ourselves at the health unit and with RVH at how that plays out throughout Simcoe as well. I've spoken to the slowing of the supply of immunizations, so we will have to see how that plays out, and certainly we will have ongoing communication with everybody involved about how that will play out, and we'll certainly prepare for the opportunity to expand again when we get a better, larger supply of immunization of vaccine. One of the things that we've done, very much in keeping with the province's direction, is to expand out the duration of time before the second dose. So with the Pfizer vaccine, originally we were instructed that we could use that vaccine targeting 21 days, 21 up to 27, 28 days. But further research has shown that you could extend that out as much as 42 days and not have an appreciable reduction in the immune response that you've got from your first dose. So we learn as we go, and we make use of new information as it comes in order to give us options for doing the best we can to protect the population of Simcoe, Muskoka, and in particular at this time, those that are most vulnerable. And with a limited supply, it's helpful to us if we can extend out that time and allow more people to get their first dose at this point in time. And as you know, we're focusing on the residents of the retirement homes at this time, who are among the most vulnerable. So we've rebooked quite a few people who were set to come back for their first dose after 21 days, 28 days. We've rebooked them out and are looking at rebooking others. We'll have to look again at the supply challenge we have in relation to this decision, but looking at rebooking people out closer to 40 days to give us more ability to extend out protection and get that first dose to those who really need it. Certainly, people are being rebooked. These aren't cancellations. We're rebooking people, following up, making sure they know their appointment, that we're setting an appointment for them that works for them. Just in terms of the support for this decision, it is based on recommendations from the National Advisory Committee on Immunizations, who are immunologists and public health physicians who have a strong background in immunizations, who weigh the evidence and the research as it comes out in order to make such recommendations. It's also supported by a consensus statement of the chief medical officers of health across the country. Okay. One of the things I would say is with regards to the response to the outbreak at Roberta Place and the tremendous coming together of community agencies in order to respond to this situation, and the corporation itself having drawn resources from its other homes to staff the facility and provide care. I would say that we've become aware that there can be fear directed towards the people that have had to respond to this situation, the care providers on site. The potential for them to be confronted with challenges with regards to the continuation of their housing, for example. And I think it's important that we view them for what they are, which is heroes responding to a situation, responding to a crisis, and they need our support, and certainly not fear and discrimination against these people. So they are doing what they can to protect themselves in their work environment and to abide by the infection control practices, but it's really important that we support them. There's, I've already spoken to the question of the strain that's affected this facility, but certainly there remains concern about the UK strain or UK variant of this virus. We've seen 15 cases documented in Ontario to date. And as I said, we're awaiting test results on samples submitted to the Ontario Public Health Laboratory System. And that will take some time, at least another week before we get the results. We've got on our website now a section about enforcement and complaints, and we've listed instances in which we've issued charges, and we've also listed the orders that I've issued to facilities or to classes of people, the entire community. And so that's information there to show you about our enforcement. I would say that it's important for everybody to know that enforcement is done not just by public health, but also by the police and by bylaw officers and also Ministry of Labor. And so this by no means is a tally of all of the enforcement that has taken place in our community. It's a tally of the enforcement we've done as a health unit. And we have also issued orders to individuals, which of course I don't place on our website because of privacy protection. We've also got updates on our website with regards to the regulatory change that has come with the declaration of an emergency, with the stay-at-home order. So you will find information about matters such as ice fishing operators and information for retail operators, short-term rental and other shared accommodations, face covering, frequently asked questions, outdoor skating, outdoor winter trail amenities, and event gatherings. So the following are some media questions that have come my way. What percentage of case and contact management for Simcoe Muskoka is being done by the province? Is the health unit considering using the newly announced virtual assistant to reach contacts, and how would it work? So we continue to be challenged to keep up with our case count, though I did note that it's improved. Our ability to get to do follow-up for our cases within 24 hours has improved with some reduction in the case count. We continue, for the most part, to ask our cases to follow up with their own contacts. So that remains part of the challenge for us. We've had to go that route. We've placed on our website a script for them, and we ask them to use that script. But we are looking at the case and contact management virtual assistant, which uses text messages to connect healthcare workers with individuals who have tested positive for COVID-19 or have been identified as a close contact. So that's something we're beginning to look at. We note that the virtual assistant provides important information to individuals, such as guidance about self-isolation. And we are looking at how much in the way of additional staffing that the province has now compiled and trained that we could make use of to help us with case and contact management as well. So we are seeking to bring that online as well to help us. In the past, we've used the services of Public Health Ontario and Stats Canada to do the follow-up to contact management. And we also are ever seeking to hire people. So we're hiring people with regards to immunizations, but also case and contact management and outbreak investigation. Do we have any more clarity about enforcement? What areas the health unit may target? The fines, are they similar to what is put in place during the first wave? So for the most part, we've issued a very limited number of charges. Fines are generally in the range of $750. We use a lot more in the way of orders, and we find that we get good compliance with orders. At times we will work closely with the police in managing a situation. If it's a larger scale nature involving a large number of people, for example, such as an institution, then we're going to be working closely with others, such as the police or bylaw officers, to help us deal with that situation. But for the most part, we are focusing on areas that generally are part of our normal work. So food establishments is certainly an area that we would use our own enforcement means. Follow up with cases and their contacts is certainly something where we use our own enforcement means. Whereas other matters such as public gatherings or people defying the stay-at-home order of the province would not be something we would be directly participating in. That would be a matter more for the police. When will you know more about the testing results for the COVID-19 variant? And I've indicated it'll be at least another week. Would you recommend calling in the military to support Roberta Place? And whose call is it? So what I would say is that I did have a lot of support. There was outreach at a political level to me by one of the mayors and some of the MPPs. I even had direct contact from the Ministry of Long-Term Care at a political level as well. All of them wanting to know what's happened, what's needed in this situation, is there sufficient support, is there a need for additional support, and part of that question was, is there the need for the Canadian Forces to be brought in to provide assistance in some way with health personnel, for example. Same with Base Borden. I had communication there as well. And so certainly there's a consideration, a possibility. At this point in time, we're monitoring to see if the other things that we've helped to bring in place are going to be sufficient or not. We're aware that that is an option, but it would ultimately be the province to determine. I might be able to advise and seek that, but it'd be for the province to determine that it's necessary, and then to make the necessary inquiries then to the federal government. North Bay Prairie Sound Health Unit has ordered its area snowmobile trails closed. What consideration has the Simcoe Muskoka Health Unit given to snowmobile trails in its own area? And I must say that before it had been brought to my attention that the medical officer of health there had taken that action, and I believe also closed other venues such as tobogganing. It hadn't occurred to me to do that. So at this point in time, I'm not considering doing that. I think I would have to see evidence that it is both helpful and necessary to make that kind of restriction. I believe it was done as a means of supporting the province's stay-at-home order, the idea being that one should not be out doing those things if you like tobogganing, or I should say snowmobiling, if in fact you're abiding by that order. And I would say generally that's true, although there may be individuals that rely on snowmobiling as a means of primary transportation at this time of year. So I would need more evidence that it's actually necessary for me to take an action of that nature. And the stay-at-home order does allow for provision for people to get out for physical activity. Tobogganing is a form of physical activity, although one would need to be careful about physical distancing when doing it. So a pregnant woman who lives within 2 kilometers of her mom wishes her mom could visit for support. What do the latest emergency measures and stay-at-home orders mean for social bubbles or support visits for vulnerable people like older people and new parents? And I would say that when I read the language, it looks rather stringent and speaks to being able to provide support for an individual who needs help getting to an appointment. So it seems very restrictive, otherwise allowing for a lone individual to be associated with one other household. I certainly sympathize with the need to be able to provide at times care and support for dependent family members, and that's something I would want to get a better sense of whether we need to advocate for broader language to allow people to provide that kind of care for those that need it in their lives. So I sympathize, and I don't think the language is very enabling of that kind of thing. How do we monitor people who are to be self-isolating, i.e. following the follow-up phone calls daily or other forms of communication? So at this point in time, we've been very stretched with regards to our cases and haven't been able to get to the contacts at all, have relied on the cases to get to the contacts. And generally speaking, we've been making one contact with cases and advising them about all they need to do. And I've indicated when the date at which they could come out of isolation, and indicated that we probably won't be following up with them when they reach that date. They can come out of isolation, and certainly that they can call us if they are in need, if they have any questions. So with the potential to have more support from the province, we would want to change that when we have the capacity for that. When the case count comes down to the point that we can manage it, we certainly want to get back to that kind of follow-up with people. Okay. So at this point in time, I'd be happy to take questions.
Okay, thank you, Dr. Gardner. We will start with Dawn Huddlestone from the Huntsville Doppler. Dawn? My question's already been answered, thank you. Terrific, okay. Mark Claremont from Muskoka.
Hi, Doctor. Yeah, read the vaccinations. So you said that there's going to be fewer vaccinations available from Pfizer. Is your intent to give those limited resources to the second dose versus the first dose?
I think the province has certainly indicated that we have to do all that we can to not miss second doses. So we have to have a hard look at how much vaccine we think is coming versus how much we'll need to give the second doses to avoid missing people in their second dose. And then if we find that we may have enough to begin or continue with some first doses, and we'll look at where they need to go. But we've just got this information and we need to take stock of it.
Yeah, that's fine. Thanks. That's okay for me now.
Okay.
Okay, thank you. Sean Gibson from Barrie Today.
Hi, thank you. I may have missed this. My phone cut out for a second. But Why is Soldiers Memorial helping out with Roberta and not RVH?
Thank you for the question. We need all the help we can get from all quarters, and certainly RVH has been providing assistance with regards to infection control assessment and testing, and receiving cases to the hospital for care. But I turned to many agencies in order to get the resourcing in place, including Soldiers Memorial Hospital. We do need somebody who would provide the on-site leadership, and Soldiers, who has provided much leadership already and support to the homes in their district, indicated that they would be willing to act in that way, to provide that kind of support, as well as the on-site testing that they're now doing. But I would also say that the whole area, the whole district is more heavily impacted by cases now, local cases, but also cases that are being transferred from the GTA. And RVH in particular has been the recipient of those, and has had to take on those additional cases for care, and some of them end up in the intensive care unit as well. RVH has their own outbreak happening, and it's expanded in size, and RVH is also heavily involved with immunization at this time. So in the end, we decided that we would continue to accept the support they're providing, accept the support that other agencies are providing, and accept the leadership support that Aurelia Soldiers Memorial Hospital was offering.
Perfect. And then again, just because I cut out earlier, I just wanted to clarify, did we get the numbers for Roberta Place, the resident cases, staff cases, and deaths as of today?
So if you look earlier in my presentation, which is up on YouTube, you'll find that.
Okay, perfect.
Okay.
Thank you.
Thank you, Sean. We're going to go on to Craig Momney from CTV. Craig, are you with us? All right, we'll come back around to Craig. Matthew Reiser from Moose FM.
Yes, hi, thanks. Dr. Gardner, following up on your answer about potentially closing snowmobile trails, I'm not a snowmobiler, full disclosure, but it seems to me like it is an activity that allows you to stay pretty physically distant. I feel like it's pretty hard to jump on another person's snowmobile when it's moving. And as you mentioned, it's an activity that is allowed while in lockdown. I know you said that more needs to be known before you could potentially make a decision whether yes or no to close trails, but do you foresee it being necessary to shut down the trails for whatever reason, maybe one similar to the reason why the North Bay Perry Sound unit did?
Well, what I found with this pandemic is that things that at first I didn't think were likely can come to pass. So I think it's important to note that, but I'm not actively considering this at this time.
Okay, perfect. Thank you.
You're welcome.
Thank you. Kate Allen from the Toronto Star.
Hi, thanks for taking my question. I just have a follow-up about the testing for the potential variants at Roberta Place. I'm wondering if all of the positives from that outbreak have been submitted for follow-up sequencing, or if not, how many? And are they going to be tested for the UK variant or also the South African and Brazilian ones?
So thank you for the question. We've, I believe it was 3 samples that were accepted for that were sent to the National Microbiology Lab. It's a 2-part test. The first test is meant to detect whether or not this is a genetic variant of some kind, and if that is positive, then they do genetic sequencing in order to get the whole genome sequenced, and from that they can determine what strain it is.
Got it. Okay. And when you say it was submitted, or these samples were submitted through the Ontario Laboratory Testing Network, I'm just curious if you can be a little more specific. Like, where did you send them, and who, basically who's responsible for chain of information here. Who should I pester after this?
Public Health Ontario Laboratory System. Public Health Ontario.
Okay. Okay, perfect. Thank you.
You're welcome.
Okay, thank you. We'll go back. Craig Momney, are you on now from CTV? Okay. John McFadden, MuskokaRegion.com.
Thank you, and thank you for taking my question, Doctor. Would you be able to address for me, please, the vaccine rollout on the 4 First Nations territories that you cover in terms of what has been done so far, what the plan is moving forward, and when those folks on those First Nation territories might see the vaccine?
Thank you for the question. There is a retirement home at Rama First Nations that we've provided immunization to, and we've also been in contact with Chippewas of Beausoleil and Wata, in that they are communities that have both had positive test results. So certainly we're concerned about that, and have preliminary plans about the working with those communities to be able to provide vaccine for immunization. The challenge that we've got now with the slowdown in the Pfizer vaccine means we need to look at all priorities as to when we can move on those. But we do regard those situations as concerning, and we do want to be able to move on them.
Oh, very good. Thank you. May I ask a follow-up, please?
Absolutely.
Go ahead.
You mentioned the Wata First Nation with positive tests. Do you have any more details upon that in terms of when those results came back and how many people were affected?
So my understanding is that 3 at Wata. Actually, at my fingertips, I don't know exactly when. I would have to inquire with my staff.
But certainly last year, I take it.
No, we are talking recent.
Oh, okay.
Yeah.
Yes, if you were able to get that information for me or Leslie, that would be greatly appreciated.
Okay. We'll see what we can do.
Okay. Thank you, John. We'll go on to Allison Brownlee from Muskoka Region.
Yes, thank you. You answered several of my questions. Thank you for that. A couple of follow-ups. Do we have any indication of when the emergency declaration from the province or stay-at-home orders, including restrictions on essential visits between households and restrictions on small businesses, may be lifted?
I'm afraid I don't know. That is a provincial decision. To me, it is heartening that it looks like we're beginning to see some results. And the timing, I think, would be about what I would expect beyond 2 weeks from, the Christmas season, the holiday season, when there was a lot of social interaction. We did see a 21% increase in our cases over that time that were related to family gatherings, social gatherings. So the timing of that would fit, and the timing of the onset of the shutdown and also fits with that. But it can take a long time to really bring it down, and I would advise that you would want to be very cautious about lifting it, and when you do, you need to do it in a staged way. So although I don't know, I don't have control over that, I would advise that it be some weeks to come, frankly.
Thank you.
You're welcome.
Just as another follow-up, if somebody had a first dose of the Pfizer vaccine, does their second dose have to be Pfizer as well?
It does. That's what's advised at this time by the National Advisory Committee on Immunizations, as well as the companies themselves that produce these 2 vaccines.
Understandable. Thank you very much.
You're welcome.
Okay. James Bowler from Cogeco. You with us, James? All right, we'll pop up to Erica Engel, Collingwood today.
Thank you, and hello. My question pertains to enforcement. Dr. Brenner, I know you said you weren't posting individual charges, but do you have an idea of how many, if any the health unit has laid against individuals regarding the stay-at-home regarding the orders you are enforcing?
My understanding is we've done 3 of such orders, such charges, and my understanding is we're actually posting that information. But when we're done, I'll have a look back and make sure that I'm completely correct on that, and if not, I'll get back to you.
Okay, it looks like there are 2 charged business organizations posted.
Okay.
One from May, and then one more recently in January in Collingwood. For today's Natural Solutions. Do you have any more information on that charge, like how the complaint came in, or what part of the section they didn't comply with?
So that's the information that we're providing to date. What I would do is talk with my staff about comfort level as to giving out more information and get back to you.
Okay, thank you.
You're welcome.
All right, we'll go on to Chris Simon from Barrie Advance.
Yes, thank you. Hi, Dr. Gardner.
Hello.
I'd like to go back to the Roberta Place outbreak if I could. And I know you said go back in the within your but did you say 65 residents and then plus another 22 residents have tested positive initially, but you've sent that for further confirmation?
Yeah, so let me go back and look at the figures in my notes. But we did have follow-up testing that was done, rapid testing that was done by Aurelia Soldiers Memorial Hospital. And they need to be confirmed according to the province's requirements. So we would be awaiting confirmation before we would indicate that they are confirmed. But nevertheless, I've provided that information for today. I think it's certainly noteworthy that we have the ability to do that kind of testing, and also noteworthy as to what it shows. So, yeah.
Is there much of a chance those numbers would be revised then, or?
I think it's unlikely that they'll be revised. The type of test they use is a very sensitive and specific test. Yeah. So yes, just to answer your question, we've got 65 residents that have had positive tests, which is confirmed, and an additional 22 tests that were from the rapid test testing done by Aurelia Soldiers Memorial Hospital, and those 22 would need to be confirmed.
Are you worried that the press release you guys sent out earlier today that you're moving into retirement homes for the next phase of vaccination, that might be potentially delayed by the news about the vaccine delay? Very
much so. And I guess timing is all, because when we released that, we did not know that we were going to get this degree of a slowdown. So we will have to follow up with a revised communication. Later today, we're going to be looking again at the numbers and deciding where to go with it.
And one more question, if I may. Just wondering if you have any inkling in terms of where we may go in terms of schools reopening.
Where we may go, maybe you could clarify a bit. I mean, that would be a decision of the provinces, so I wouldn't be able to influence or, make that decision myself. If you could clarify, that would be helpful.
Sure. Okay. Let me revise that then. Do you anticipate children will be in school next week?
I don't know. I think that there's an awful lot of concern about the amount of transmission happening right now, the ability of schools to remain open with that degree of transmission, considering that every case that occurs at a school leads to a large number of people that are then isolated at home. Of course, people have concern about transmission in school, although I believe that the likelihood of transmission in the community away from school is greater, much greater than in school. I do know there's been effort made to identify how you would make the school even safer, such as the requirement of face coverings down to grade 1, and recommended for kindergarten as one of the options. As a health unit, a public health community, we certainly support the idea of getting children back into school because it's important for their health, well-being, their education.
Thank you very much.
You're welcome.
Thank you, Chris. Is there anyone who has not had a chance to ask a question who would like to?
Mandy from Rogers.
Oh, I'm sorry, Mandy. Please go ahead.
That's okay. I came onto the call a couple minutes late. I just have a couple questions. Thank you, Chris, for asking the school one. I was under the impression that the Chief Medical Officer of Ontario was going to be talking to the Chief Medical Officers in each region. So I wondered also that same question. So thank you for asking. The word plateau has been thrown around. Dare we say that we are plateauing, Dr. Gardner?
I'm hoping that we're actually declining, the beginning of the decline. We've seen, we had a sharp rise up until a week ago, and then the past week we've had some decline. So a week is not enough to be able to determine a trend, but it's not just that it's the same as it was the week before, it's actually down from the week before.
Okay, that's even better. A couple more questions, sorry. Any idea what percentage of protection one dose has instead of 2? You said one dose was better than no doses. Is there a percentage there?
Yeah, about 85%. As opposed to 2 doses?
One dose would be.
Yep. What is not known is duration of protection. And also it's not as high as 2 dose, which is 95%.
Wow, but one dose is 85. Okay. And my last questions are in regards to the percentages you gave of residents who are immunized against staff who are immunized. Some of them are quite different, ranging from 80% of residents or 90% of residents to 40% of staff. Is that because it's a staff choice or a resident choice, or you can't get all the staff at once, or how does that work?
It's a very good question. Everybody has a choice in this. The residents or their caregiver, their family member, if they're, they've given them that choice, if they aren't able to make that choice themselves, it's completely voluntary. But we do have a very high uptake among the residents in the 90% range or more, and that's a very good thing. And I think that they're making a wise choice. And what we've noted about staff is they've not had the same degree of options as the residents. The residents, we were able to go to them and make it very easy. The staff, we were providing it for the most part at our clinic on Sperling Drive in Barrie, and that meant a drive, and for some a long drive. We did see some better uptake closer, those that live closer versus those that were farther away. And we also noted in the instances where we were able to provide it to staff at the facility when we arrived, which was limited, but in some instances we were able to do that, we had a higher uptake, more like 70% instead of 50%. So if you make it more readily available to people, you're going to get a higher uptake.
So it comes down to more accessibility than people refusing to get the vaccine, is what it looks like in these cases.
I believe so. And that is an important lesson for us. When we go forward with immunizing the broad community, that's an important lesson for us. We need to have multiple locations throughout Simcoe, Muskoka to do a really good job.
Wonderful. And just my last follow-up question. A resident who has, say, been infected with COVID-19 but recovered, do they still have to be immunized, or are we skipping over them?
So nobody has to be immunized, but in terms of would they benefit? They would benefit because we don't know how long immunity would last with natural infection, and so they would. It is recommended that they receive the vaccine as well. But it's also recommended during a time of shortage, like at the very beginning of this campaign, that people who've been infected before actually delay getting immunization by 3 months, perhaps, to allow others who don't have any protection at all to receive the vaccine at this time. So hence, in our facilities, we're not giving it to those who've already been cases.
Got it. Thank you.
You're welcome.
Okay, thanks, Mandy. One last call if anybody's been missed and would like to ask a question. Go ahead now.
Can I just confirm, you said you're not giving it to people who have had COVID right now?
That's right. We're not. For the reason that I've stated, that although they would benefit from it, we really need to give the vaccine to those who have no protection at all at this time because of the limited supply. We would most certainly want to come back and offer it to those who've been infected later in the campaign when we have a lot more vaccine.
All right. Thank you, Dr. Gardner. This will be the end of our conference. So thank you, everyone, for joining us.
Sorry, Leslie. John McFadden again. Could I just ask one more question, please? I'm sorry. I was waiting for you to see if you were coming around one last time. May I ask one more question, please?
I'd be happy to take it. Please do.
Yeah, Doctor, as you're probably aware, there is a reluctance amongst some Indigenous people in the Simcoe, Muskoka area to get the vaccine because they have an inherent mistrust of the healthcare system in light of, decades of troubling stories and abuse and that sort of thing. Is that something you care to address, and are you able to say what you might say to Indigenous people that are having second thoughts about getting the vaccine because of the track record?
I would say that I sympathize with their concern with the history. I acknowledge the history. I think it's really important that we work closely with leadership in the Indigenous community about what we wish to do and why and how that would be received and what they would advise about the approach to it, what they would advise around communication, the degree to which they could be communicators on this, or leaders on this, or others in the community, elders or others who could be leaders on this, but we really need to work with these communities. And in the end, autonomy and personal decision has to be respected.
Thank you very much.
You're welcome.
Thank you for the answer.
I thank you, everyone. We will meet again next Tuesday for our next briefing, and everyone have a safe week. Thank you.
Thank you.
Goodbye.
I now want to turn that into my 4-season home. I want to turn that into my daily home, and I'm willing to telecommute or work remotely and make this my home and raise my family here.
I literally have a client I'm working with right now who purchased a home in Clearview Township. The owners of that home, and it's a beautiful home, I asked, why are you selling? They have a cottage in Kenora, and that's going to be their full-time home. And he's in the technology industry as well. And this is what kind of spurred today's subject, because he says, I'm going to be able to work from the cottage now with high-speed internet. He is already connected as one of the beta testers for Starlink. So that was what got my wheels spinning on this show. And I thought, well, if he's doing it, this is going to become the norm. And more people are going to be leaving the city. And again, you're talking about changes that are dictated by affordability with people. And yes, with 2 cars, with the kids in this sport and that lesson and everything else, our costs of living are going up faster than our incomes are. So we're looking for efficiencies elsewhere. And moving to a rural location is probably one of the biggest opportunities to save on your month to month. And again, having being able to take that high-speed internet and all those amenities with you to the rural property is that game changer. And I think we're going to see developers tapping into this too and buying up some of that rural land that is fairly inexpensive because it was unserviceable prior to now. And, now that it will be, virtually on the grid instead of off the grid, it's now there to build on. Be it an independent URI wants to build their single home or convert the cottage to full-time year-round, and then the developers who are going to be cherry picking some of that property in the early years going forward.
Mike, I would argue that this isn't going to go without a challenge. And the challenge is going to be that municipality, well, certainly for the last 30 years, there have been those who have been pushing the idea of higher density is the more intelligent, more economically viable way of doing things. We already proved many decades that you can't just have pockets wherever you want because it's impossible to afford to run the services there. So there is going to be, again, some pressure on that. We don't have a lot of time, but one of the things I would tell you is that it certainly is viable to slightly adjust your home-based footprint to account for a home office. The Revenue Canada, and I'm imagining in the States, the IRS is doing something similar, is applying or allowing for tax credits if you have to work from home. So there's been the environmental push. There's been the financial shift towards high density. There still is affordability, which Nick Nanos talks about. We're not going to get away from what people can and can't afford. But again, we're going to see this shake out. I don't exactly know what it's going to look like, but I'm willing to bet that if employers are willing to get away from some of their lease obligations and their overhead, if Revenue Canada is in on it, if technology partners and influencers are in on it, you better believe that there is going to be a shift in the next 5 years.
Yeah, for sure.
Why don't you wrap us up? 30 seconds to you, Mike. I
look forward to that shift. Yeah, I look forward to that shift. I think it opens up a world of opportunities. And you know what? It'll have to be done in a balanced way. And of course, we do have stop checks in place there for, protecting our environment and everything else on rural areas. But I think our dependence on the city is shifting and changing. And I think our living needs and demands are going to shift right along with it. So I look forward to that. And
perfect. I'm going to throw my industry under the bus, and I would say to you that, as usual, they're the last to get on board. The financial industry is going to have to shift the way they do risk assessment and underwriting because they have been reluctant to do this. We got to go, Mike, but I can't wait to see what we talk about next on Hitting Home. So join us again. Thanks for being with us today on Hitting Home with Mike and RF.
Call the Rogers TV viewer response line, email us, or connect with us on social media.
Blood in the urine is the most common symptom of bladder cancer.